I'm very grateful to my brother Nugo. He allowed me to speak. He knows that I am in love with the sound of my own voice. But it's a privilege to speak to a friendly audience. Now, diseases of the winter. We are all aware of this big story that the winter affected the NHS badly. People were queuing in corridors. The A&E departments have not been able to cope. The winter flus, the difficulties of taking antibiotics. Should we take antibiotics? Should we not take antibiotics? And the anti-flu vaccination, all these problems. Yes, the flu is a problem. There are pandemics of flu. That's influenza A virus that affects countries, not just one country. That's why they call it pandemics. This famous one was 100 years ago in 1918, and it killed about 50 million people. By 1940, 1942, people developed the anti-flu vaccination. And it's a guesswork. It's trying to anticipate which strain of the virus, usually influenza A or B, is going to be the one responsible for the winter flu, and give people vaccines in the autumn to prevent them catching the flu. But it's a bit of a guesswork. Its effect really is only 50 to 60%. And unfortunately, there is a 4% chance that if one gets the anti-flu vaccine, it will give him or her the flu. So my advice to patients who ask me, should I take the anti-flu vaccine, is this. Have you taken it before? Yes, I did. Did it upset you? Oh yes, upset me so much. Don't take it. But if it didn't upset you, it's useful because it protects against the vicious types of flu that can be dangerous, especially in the elderly, especially babies, especially people who have chronic chest problems. Many conditions flare up, if you like, during the winter. Most importantly, asthma, because asthma is an inflammatory condition. And we don't know the cause of asthma. We doctors are conceited. We never say we don't know. So we call diseases that have no cause that idiopathic. We say, oh, what's the cause of asthma? We don't know. What's the cause of arthritis? We don't know. What's the cause of thyroid underactivity? We don't know. What's the cause of high blood pressure? We don't know. And instead of saying we don't know, we say it's idiopathic. Idiopathic is posh. It means we don't know. So in the 21st century, what we don't know is really more than what we know. Allah knows the cure for every disease. I got 3 quotes from the Quran about diseases. Now I start with Job, Ayub, when he was afflicted with a skin problem. And Satan teased him. God is not curing you. So at the end of the day, Job was so fed up, he asked Allah, he says, وَاذْكُرْ عَبْدَنَا أَيُّوبَ إِذْ نَادَى رَبَّهُ أَنِّي مَسَّنِيَ الشَّيْطَانُ بِنُصْبٍ وَعَذَابٍ. Remember our servant Job, when he called to his Lord, indeed Satan has touched me with hardship and torment. So Allah told him, أُرْكُضْ بِرِجْلِكَ هَذَا مُغْتَسَلٌ بَارِدٌ وَشَرَابٌ. So he was told, strike the ground with your foot. This is a spring for a cool bath and a drink. So Allah cured him. We don't know exactly what skin condition he had, but that water removed his illness and cured him. In another verse, Ibrahim is speaking to Allah, glory is his. He says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِي. When I am ill, he is the one who cures me. And we have Yahya, when he wanted very badly to have a son, but he was old, his wife was barren, so he asked Allah, He said, رَبِّ لَا تَذَرْنِي فَرْدًا وَأَنْتَ خَيْرُ الْوَارِثِينَ. My Lord, don't leave me alone with no heir, while you are the best of inheritors. Allah answered, فَاسْتَجَبْنَا لَهُ وَوَهَبْنَا لَهُ يَحْيَى وَأَصْلَحْنَا لَهُ زَوْجَهُ. We responded to him, we gave him John, we amended for him his wife. So infertility is curable. Everything is curable. And of course the miracle of Jesus. Jesus was sent to prove that by God's will he will cure diseases. In Surah Al-Imran, وَرَسُولًا إِلَى بَنِي إِسْرَائِيل, a messenger to the children of Israel. أَنِّي قَدْ جِئْتُكُمْ بِآيَاتٍ مِّن رَبِّكُمْ. I came to you with a sign from your Lord. أني أخلق لكم من الطين كهيئة الطير فأنفخ فيه فيكون طيرا بإذن الله. I blow, I shape something like a bird, I blow on it and it becomes a bird. Then he said, وَأُبْرِئُ الْأَكْمَهَ وَالْأَبْرَصَ وَأُحْيِي الْمَوْتَى بِإِذْنِ اللَّهِ. I cure the blind and the leper, and I bring the dead to life by Allah's will. Now, abras, it's always translated to leper, leprosy. It's not. Abras from baras, and baras is from bors. Bors is a lizard. This is vitiligo. Because leprosy is curable. You take a course of antibiotic treatment to cure leprosy. So it is vitiligo. People who have various depigmentation in their skin. Some is brown and some is white. There is no cure for that. But there is cure, but we don't know it yet. But Jesus was able, with God's will, to cure it. Finally, a quote from Prophet Muhammad, may the peace and blessings of Allah be upon him. He said, إِنَّ اللَّهَ عَزَّ وَجَلَّ لَمْ يُنزِلُ دَاءً إِلَّا وَقَدْ أَنزَلَ مَعَهُ دَوَاءً. Allah will never bring a disease unless He brings its cure. So all this idiopathic nonsense, we are waiting for the cure. Now the antibiotic fiasco. Don't take antibiotics. I was in the Royal Mosque yesterday because I do the Friday sermon next door in the Brompton, and I picked a leaflet from the Royal Mosque waiting room. Taking antibiotics, it says. When you don't need them, they put you and your family at risk. Don't take antibiotics. 5 years ago, the Times of London, December the 19th, 2012. Stop fighting chest infections with antibiotics, GPs are told. I made 10 copies here. We can have a draw and see who will get them. And the message was, amoxicillin, the most common antibiotic, is useless in fighting chest infections, and we should not prescribe it. And they had the cheek to say that, the evidence. 13 million prescriptions for amoxicillin were written by GPs last year, a third of all antibiotics prescriptions in England. So they wanted to do a study to find out if those 13 million prescriptions were justified. So what they do, they did a trial. They just asked 2,000 patients. 2,000 patients around Europe with common chest complaints. They asked them if amoxicillin was effective. And the majority of them said, no, it wasn't really. It didn't make a difference. So the conclusion is the experts said antibiotics are useless for chest infections. So I got furious. So I wrote to them and they published. I said, sir, it's wrong to tell family doctors to stop prescribing amoxicillin for common chest infections. This advice is cost-driven and dangerous, which is true. A trial based on 2,000 patients around Europe is not sufficient to pass judgment on 13 million prescriptions of antibiotics. Those researchers, and I'm being nasty now, those researchers, those experts who advise GPs are academics. It's true. And not clinicians. They do not see patients. Then I became conceited. I went on to say, I am a chest physician with 30 years experience, and I see many patients with chronic respiratory diseases resulting from withholding antibiotic therapy. The usual scenario, it's a virus, and the child ends up with a damage, a scar, we call it bronchiectasis, cough, and physiotherapy all their lives because antibiotics were not given, or the child may die. This, to assume that the most mild respiratory infections are caused by viruses and not bacteria is wrong. Babies die of pneumonia, I said, because they were denied antibiotics. And this question of antibiotic resistance has been exaggerated, I wrote. It's scaremongering, it's a tactic to save money, which is true. I work in the Brompton. Well, I retired, but I still go. There is a saying, it says, once a Brompton physician, always a Brompton physician. So we never retire. We die working in the Brompton. The Brompton is a center of excellence. You know, every hospital in the United Kingdom has a chest unit. But the chest unit has chest physicians who do everything. Asthma, infection, tuberculosis, sleep apnea, cystic fibrosis. But in Brompton, we do one thing. We've got firms. So I am with the infection firm. And then we have the asthma firm. Then we have the bronchiectasis firm. We have the sleep apnea firm. So we know, we see. And every now and then you read in the papers that a baby was taken to the casualty, running a temperature, not sleeping, and coughing. And they check the baby or check the toddler. Nothing wrong, give them paracetamol. And the baby died. And typical. There's second to none, this Britain. I lived here for 40 years. And I coined this phrase, second to none in excellence and in failure. Nobody goes to jail. There's an inquiry, and lessons are learned. We make sure that it doesn't happen again. And then it happens again. And the madness, they don't prescribe antibiotics unless for severe infections. Why? And they quote here, sepsis. Sepsis, it's like describing adultery as making love. I'm sorry to quote this example. Sepsis is septicemia. It's a very dangerous situation. To wait until one gets sepsis, one is just death door. It's just too advanced. Now, the advice is common sense. Flu, bit of a cough, bit of a fever. If it doesn't settle in 48 hours maximum, especially if one starts coughing up phlegm, must take antibiotics. Nobody ever dies of taking more antibiotics. This question of resistance is again scaremongering, cost-driven. We never ever lose any patient to multi-resistant organisms in Brompton. Why? Because every drug, those super bugs, have got antibiotics to kill them. They are expensive. But we use them because money is no object in Brompton, but not in St. Mary's, not in St. George's, not in any hospital. So this MRSA, no problem. No problem. We cure it. But to save money, don't give antibiotics. Typical scenario, and I get old stories from my good wife who is in general practice. A typical example is a family, they bring their baby or their child to her. Oh, he has been coughing and stayed up all night and cannot sleep, and she would listen to his chest and she says, okay, then give them this antibiotic. Then the mother or the father, because of the influence of the media and the state, do you think it's necessary, doctor? Yes, it is necessary. Give them the antibiotics. They go and come back in 2 days. Baby's not better. Did you give them the antibiotics? No. Why? Because they say antibiotics are not good for you. You see this? They want to save money, as simple as that. It's like alcohol-related diseases and tobacco-related diseases. We know that alcohol causes a lot of diseases, but the revenue from the alcohol far exceeds the money spent to cure diseases caused by alcoholism. So the country benefits if people drink too much. So they make the offers, make the alcohol cheap, and say drink responsibly, for heaven's sake. People are drunk, they cannot be responsible. It's ridiculous. It is just, it's obscene, to be honest. Tobacco, another thing. The tobacco revenue far exceeds the money spent to treat smoking-related lung diseases and the chest and heart diseases and cancers of all sorts. But they never ban smoking. They just don't advertise it openly and keep offering people. And they invent ways of making smoking appeal, like the sports sponsorship and all sorts. Asthma is a very common problem, and it does flare up in the winter. We don't know how to cure asthma, but we know how to suppress the symptoms and control the asthma. 1 in 5 children living in London has asthma, and 1 in 10 adults in London has asthma. And the treatment is available and is second to none. For 20 years, 1,500 to 2,000 people die every year of asthma. And it has not changed. And we are in the United Kingdom, when medicine is truly second to none. Why? Because, again, of the cheek. They've got guidelines. And I hate this word guidelines. I lecture my junior colleagues and I tell them that guidelines are rules for the fools. Simple as that. Guidelines. Treat asthma with the preventer and the reliever. And when the symptoms are better and the asthma is well controlled, scale down. That's the problem. Scale down. Satan's work. Scale down means reduce the amount. Now, reduce the amount will get the symptoms to flare. It's like someone who has high blood pressure and is very well controlled because they take their tablets. They go to the doctor, take the blood pressure. Oh, the blood pressure is normal now. I can stop everything. We can't stop everything. It's down because the medicine is working. Similarly, asthma. And they employ practice nurses, experts in asthma. And the practice nurse will go on with the consultation like this. Do you take the preventer? Yes. Are you all right? Yes. Oh, we know this preventer. Okay, we don't have to take it really unless you feel that the asthma is bad. Now, that's a very awful advice. That means throw your asthma away. Don't remove the control of your asthma. It's patients' nature to resist labels. You tell someone they have asthma and they hate it. It's not cool. That means they'll carry an inhaler. Young people hate it. We can't cure asthma, but you have to tell them this. The preventer is the one to take when you are not well to stay well. And that's something that people cannot accept. Cannot accept. Again, my good lady tells me that families come. The baby is wheezing, baby is coughing, and she'll ask the parent, who has asthma in the family? Oh, his father. Okay, well, it runs in the families. The baby's asthmatic. Oh, no. Just give them the relief one. No, you have to take a preventer. So she gives them the preventer. Go home, come back in a week, still coughing. Did you give the preventer? Yeah, I gave it once, actually twice. It did work. He was better, but then I stopped it because the asthma nurse said, these are steroids. You know, steroids are not good for you. What the asthma nurse really wants to say is, these are expensive. The Ventolin, which is the relief inhaler, is only £3. The preventer, which is Seretide or Pulmicort, is £50, £40. So they want to reduce the cost, so they say scale down. And it's terrible. And it's a privilege again to work in the Brompton because we have time to spend and explain to people that there is no cure for asthma. Asthma means sensitive airways that we cannot cure. And this inhaler, yes, it's a steroid. It's a very small dose. It would do no harm. It would keep the lining of the tubes calm, and take it when you are well to stay well. And the usual answer I get, is, oh, why nobody told me that before? Nobody will tell them, because if people tell them that, they will take it regularly and they will cost the NHS more money. It's scandalous. Chronic obstructive pulmonary disease, which is an umbrella terminology. It means emphysema or chronic bronchitis. It's an awful disease, and it's caused by smoking. And 99% of smokers will end up having emphysema, and it's a terrible thing to have. Emphysema means big lungs. It's a Greek word. And I tell my patients how to feel like having emphysema, and you can all do it now with me. To feel what people with emphysema feel is to take a deep breath until you can't take anymore, like this. And then hold it. Then try and breathe in and out on top of that without breathing out. So you're holding breath, and then can't breathe in and out when you're holding your breath, and that's exactly what people with emphysema feel all the time. And it's awful. 1 in 8 smokers gets cancer. It's like a Russian roulette game. When you tell 8 people crossing the road that one of them will be knocked down by a car, nobody crosses the road. You tell 8 people smoking that one of them will get lung cancer, everybody thinks it's not going to be me, it's going to be someone else. And you can prevent. Vaping is good. Now, vaping is certainly not as dangerous, not dangerous at all as smoking, because what causes cancer in the cigarette is the tar. And vaping, you are inhaling the pure nicotine. If you inhale pure nicotine, you may become addicted to it, but it will not cause lung cancer. People say, but teenagers will take up vaping, it's becoming fashionable now. Like the shisha on Edgware Road, people are smoking apple and smoking whatever. It irritates the airways, but it doesn't cause cancer. So let them vape. The sad thing is that ladies are starting to smoke. It's a privilege that men had paid the price for. And the usual scenario in the clinic is that men, 70-year-old men are coming, sitting in a wheelchair, useless, with oxygen masks, and the faithful wife is pushing the wheelchair. And this is the fate of women if they don't stop smoking. They will sit in wheelchairs when they are 70, and the faithful husband is not faithful. Men are not faithful. The husband will go and marry another one. So she'll have nobody to push the wheelchair for her, which is sad. Human nature. Actually, people with emphysema who are married, men with emphysema who are married, live longer than men with emphysema who are not married. Because of course they are being looked after. Chronic obstructive bronchitis means cough and phlegm every day for at least 3 months every year. That's again disease caused by smoking. If you never smoked in your life, you cannot have chronic obstructive pulmonary disease. Some GPs, with the greatest respect, label anybody with chronic obstructive pulmonary disease. No, asthma is common, and it is a form of asthma. Now, asthma, there is no test to diagnose asthma. Well, there is one, but it's not 100% foolproof. Asthmatic people have sensitive airways. If you make them inhale histamine, it irritates them, and they get an asthma attack. And we do a histamine test, but it's not 100% foolproof. And I get referrals, and I get a big kick from that. I get people, it doesn't matter which age group, some in it, 30s, 40s, 50s, even 80s, have been to the chest doctors, checked, did the spirometry, which is the breathing tests, normal. Been to the cardiologist, checked their heart, normal. The problem is they are breathless. They are breathless. It's a disease you diagnose by taking a good history. And I get my kick. I just ask the lady or the gentleman, just go back and tell me, was there any time at all when you had an attack of breathlessness? They always come with a story. Oh yes, I remember. I woke up once and I was wheezy and I went to the casualty and they gave me some injections and some nebulizer. And that was 30 years ago. That was asthma. But people are reluctant to diagnose asthma. And of course, I put them on the anti-asthma treatment and they are better. And they stop and it flares up again. Am I going to be on this for the rest of my life? So what? It's free, especially after 60. Above 60, we all get the medicine for free. But people resent it. And asthma can be weird. We have a variant of asthma called exercise-induced asthma. They are only asthmatic, they get wheezy when they exercise. Typical scenario is when they walk or run or run for a bus or climb hills, they have wheeze. They go to the GP and if they are elderly, what do you expect? If they are carrying something, they are carrying something heavy, obviously you get wheeze. Nobody diagnoses asthma. Or they cheat. They give them the Ventolin for relief and they tell them, I thought use it. But what do I have? Oh. So those people who come to me having seen everybody and had all the tests and were told that it's just one of those things. There is nothing called one of those things. There is asthma. And asthma kills 1,500 people every year. Because we don't listen and we don't advise people properly. It's a problem. Doctors do not advise, don't tell them and stress to them that you have to take the medicine when you are well to stay well, and patients resent this label. It's a funny story. One of my patients had seen my colleagues in Brompton. His presenting symptom was when he has intimate relation with his wife, he becomes wheezy. And dismissed it. Of course it is asthma. And we are lucky, we have a treatment now for exercise-induced asthma, which is singular, Montelukast. It's one tablet every night, and people love it. But you've got to have exercise-induced asthma, not asthma all the time without exercise. So if you wheeze when you climb hills or run upstairs or do any physical exertion, that's the answer for you. We have the state-of-the-art treatment. We have the preventer treatments that control asthma 100%. I have a video of myself from 1996. 1996 is 21 years ago. They came to Brompton, the BBC, because there was a big story about people dying of asthma 21 years ago. And I held an inhaler in my hand and I shouted, "This is the state of the art," I said. It's excellent prevention treatment. If people comply, if people take the preventer when they are well to stay well, nobody will die of acute asthmatic attacks. 20 years on, I still say the same thing. And general practitioners, if they wish, they could check. They know that people take prescriptions for the reliever. So during a 12-month period, they've taken 12 relief inhalers, maybe 20, but took maybe 2 or 3 preventers. That's an alarm bell should ring. But nobody cares, sadly. And they scale up and scale down, scale down. Rules for the fools. And drug companies fight each other. There are so many preventers. Some companies promote their own brand and say that the rival brand causes pneumonia. Fancy. They say steroid inhalers cause pneumonia in people with chronic obstructive pulmonary disease. They get flare-ups every now and then. They call it an acute exacerbation, another posh word. Flare-up. That's easy to treat. And none of my patients who has chronic obstructive pulmonary disease gets acute flare-ups. Why? I give them a course of prevention treatment, an antibiotic course, once a month. It is expensive, and I get letters from my colleagues in general practice. Is it really necessary? Is it the guidelines? I say, guidelines are rules for the fools. Take them. 5 days of something called azithromycin every month. They never get flare-ups, and they use their steroid inhaler. Scaremongering. The steroid inhaler is £64 a month. Well, the azithromycin is £13 a month. It's common sense. I fear that one day we doctors will be replaced by robots who know the guidelines, and they will apply the guidelines. You go to them and you shout your symptoms, they will tell you do this and do that. But there are things that you don't learn except when you practice your speciality with care, like traveling. 40 years on, I've been a chest physician. People who fly come back with a flu. So you fly for a holiday or to visit loved ones, they get the flu. They caught it on the aeroplane. On the aeroplane, we are 300 people sitting, breathing the same air. It's recycled. So there's an answer to that. A course of azithromycin, 3 tablets. 1 tablet before you travel, 1 tablet on the day you travel, 1 tablet on the day you arrive at your destination, the day after. And you repeat the same thing on the way back. None of my patients who travels by plane gets acute flare-ups of flu or cough or bronchitis. It's not in the guidelines. Who cares about the guidelines? I make my guidelines. Guidelines are rules for the fools, which is true. It's ridiculous. Now, we talked about asthma. I can talk about asthma all day long. It's a scandal that people still die of asthma in the 21st century when we have the best medicine to control it. Chronic bronchitis, we should eliminate chronic bronchitis. We should stop smoking. Tuberculosis, although it's a disease of the past, but we ethnic minority people are susceptible. It's a very intriguing subject, and there is a lot of ignorance among doctors and the general public about TB. I feel very passionate about TB because Brompton was actually built in 1846 as a hospital for consumption to treat pulmonary tuberculosis because it was incurable. And other hospitals, we had Barts, we had University College Hospital, we had other hospitals, but they wouldn't take people with TB because it wasn't curable. So Queen Victoria, her friends managed to convince her of the need to establish a hospital for TB. The story of TB is a success story. Then we became complacent. 1977 to 1993, the TB rates of infection were coming down every year by 2%. 1990, Margaret Thatcher, bless her soul, closed all the chest clinics up and down the country because TB was controlled. What chest clinics did, and what I did in my chest clinic, everybody who comes from ethnic minority background, we check them. If they don't have TB, we give them the BCG. If they have a tendency to have TB, we give them a short course of anti-TB prevention treatment to stop them getting TB. That stopped, and since 1993 until now, every year, TB rates are up by between 2 and 5%. And we are documenting our failures. We don't want to open the chest clinics, it will cost money. In America, they had the same thing. They spent $1 billion. They brought it down under control. We are susceptible. The rate of infection of TB in the white community is 10 per 100,000. Among people from Egypt, it's 50 per 100,000. People in Asia, it's 100 per 100,000. Some places in Asia, it's 300 per 100,000. If we leave our places and come here, we bring with us our susceptibility to TB. So every newcomer should be X-rayed. And in the 90s, I wrote again in the papers, but I didn't bring them with me today, that typical scenario, someone comes from the Philippines or from India and stays in the country for 5 years, starts coughing, cough mixtures. When the cough doesn't go, amoxicillin. When it doesn't go, send for an X-ray, advanced TB, infectious TB. Probably infected about a dozen people. Treatment is easy, diagnosis is easy. Phlegm, examine the phlegm, find the TB bug, give them a course of treatment. So we should always take cough seriously. If we cough 3 weeks on a course of antibiotics, we are not better, ask for an X-ray. So if really I leave you with one recommendation today, one advice is question the need for antibiotics and don't withhold it if you are not well. If they try to fob you off with this virus thing, ask to prove it. You see, a viral infection can be proven by a blood test. I diagnose viral infections. You take a blood test and you do antibiotics. You look for the antibodies against the virus and you say, oh, this is influenza A virus, influenza B virus. But people can have meningitis and they just have what looks like a viral illness. There is no documentation. So don't accept this, it's viral. Take a course of paracetamol and hot drinks and it will get better. Because it's dangerous. And don't ignore cough. Cough and phlegm lasting for 2 weeks, not resolving on antibiotics, maximum 3 weeks. Seek advice, demand an X-ray. Smokers and ex-smokers are susceptible to lung cancer, even 5 or 7 years after stopping completely. In America, because they have money, they do routine CT scans, which is very sensitive. I have a sad story, lady. One of my patients was a lecturer in the university, and it took me 7 years to get him to stop smoking. And every year I see him and X-ray him, and he's fine, clear. 1 year he had a spot and it was cancer. And we couldn't cure it because it had spread to the lymph nodes. Had we done routine CT scans, which are expensive, we would have detected the lung cancer every year, early and cured it. In America, they do it. In Britain, it's not cost effective. Sad. Money controls everything. It's very sad. Like gastric cancer, stomach cancer is a killer. By the time we diagnose stomach cancer in the United Kingdom, it's spread. And people die, of course. In Japan, nobody dies of stomach cancer because they don't wait. A week of symptoms that are new, acid indigestion, just in discomfort, endoscopy, and they look for cancer. Here, again, the guidelines. You've got to have at least 2 months of what they call dyspepsia, that means indigestion, by which time they do the endoscopy, the cancer is spread. So asthmatics should take the medicine, the preventer, when they are well to stay well. Cough, phlegm, needs antibiotics. People are not telling the truth about antibiotic therapy. I think I should stop because it's now past 10 past 4. Thank you very much for listening. I've got 10 copies here of the antibiotic story and 10 copies of my letter. You're welcome to take them. And many, many thanks for listening. God bless you. This is fine.
I like the clapping.
Allahu Akbar, Allahu Akbar.